really very thankful to Professor Maiti for choosing University of Kashmir for this collaborative program. Indeed, it's the beginning, as you said, in order to have much more wider programs and much more elaborative programs where we can rope in not only the departments of our university, but also the other institutes, other universities, colleges of our UT. As you know, University of Kashmir is a premier institute in the UT of J&K for higher education and has grown a long way, but also have seen many challenges, but in spite of those challenges has become very visible in our country with the NRF ranking 33 and NAC accreditation A+. And I'm happy to say that our CIRI center has made this university more visible. You came in one of the meetings in our university to assess about a project, and there you got this idea that University of Kashmir has a potential to move forward, and that's why you are today here with this collaborative program. So I'm very hopeful that in future also many more programs will come. And as we know that genomics is playing an important role in our day-to-day life, early diagnosis of a disease can significantly increase the chances of successful treatment, and genomics can detect a disease long before symptoms present themselves. Genomics is emerging as a valuable tool in identifying rare genetic diseases that had previously taken years to diagnose, ending the uncertainty and suffering of diagnostic odysseys. Of course, this two-day symposium, that's Genomics Towards Better Health, is a timely and significant event that will explore the latest advances in genomics and their potential in healthcare. This symposium will provide an opportunity to scientists from frontier areas of molecular genomics to share their knowledge and expertise with students and faculty members. About 50% of the participants in the symposium are students from various colleges. I am happy to know that. These include, GMC Srinagar, GDC Boys Anantnag, GDC Sumbal, GDC Sopor, GDC Women Anantnag College and Islamia College. I am happy to see a good number of participation from these colleges, and I am sure the sessions will be very beneficial for them, and there will be some takeaway for them in their research and academics. And lots of projects are coming, lots of high-end equipment, research equipment is coming, and University of Kashmir is committed to the development of this center in view of new education policy 2020, and the way it is developing, the way it is carrying its research, I am sure that it will become one of a very vibrant institute of research in whole UT in near future.
We, on behalf of the University of Kashmir and on behalf of my Honorable Vice Chancellor, I welcome you all to this two-day national seminar, which is probably now the new subject rather to study, particularly the students who have come from the colleges in our UT of J&K. The genomics, which is particularly related to the aspect of health, is probably the scientific study of complex diseases which are probably caused by both genetic as well as the environmental factors. So earlier we used to say that prevention is better than cure. And probably now what we used to say about the prevention, we used to say that don't go for smoking, don't go for taking sugar, don't go for alcohol or other things. Probably now the new phenomenon is the genetic mapping or genetic study of the human beings. And to reach out to the diseases which are quite fatal, not only they take the lives of the people, but also they take the social fabric, economic fabric of the societies. I also wonder that probably when we see, I am not from the field of genetics, but when we see that some children are born with defects, genetic defects, and when we ask to the doctors or when we ask to the common person what is the cause of this health issue among the children, newborn children, and they say to us that it is probably because of the genetic mutation or genetic factors that cause this child to be born as a physically disabled or physically challenged person. And particularly when we go for the marriages in Muslim societies, particularly we go for the marriages with our primary or secondary kins also. So hopefully this will, if before marriages this genetic issue is taken care or it is analyzed or evaluated, most probably we will have not such unproductive or so disabled persons, disabled newborn persons. So my request, because we have now developed a center, CIRI center at University of Kashmir also. Honorable Vice Chancellor is already very particular about creation of certain centralized facilities at University of Kashmir, and we are trying to infuse and trying to extend all our support for creating a centralized facility at University of Kashmir. We at present have, this year only we got a mass pack which is probably costing us 8.5 crores, one single equipment. And we have got many more equipment, as high-end equipment, as confocal microscope, some other equipment which are very high-end, which costs are not less than 1.5 crores or 2 crores, and this was the of 8 point some crores. So we are trying to create a centralized facility at University of Kashmir. My request that because I am always telling that we are living at a centralized place, and this is the oldest institution with a NAC accreditation of 3.31 and A+ grade. We have been graded very recently we have been graded by Ministry of Education as 33rd university in the country, and we fall in top 50 universities of the country. And we also are inhabited in a place where we have few sister universities and sister institutions around. We have an NIT at our doorstep. So cost is just 2 kilometers away from here. We have SICMs at 2 kilometers distance. Similarly, SMHS is at very near place, and Central University has also come up very near to us. So I am always requesting the academics and the research partners that let us collaborate, let us do interdisciplinary research, and let us come with certain positive recommendations so that we can benefit the masses at UT level as well as the national level.
Genomics is going to be a very important subject for each and every country, and that for even India But that time genomics was very expensive science to practice. So he could convince that time to the funding agency that we should start an institute dedicating on research around the genomics. So at this moment in 2003, we have achieved a lot in the area of genomics. The first draft of genomics costed us more than $10,000. Today, if you want to do any genome sequencing for individual, it will cost less than $1,000. And near future, we expect the cost of sequencing for individual will come down. What does it mean? It is giving a huge opportunity for us to understand health per se in a better way. So the time is coming, any individual are going to visit a doctor, and if doctor want to prescribe the medicine for a particular disease, he or she may come out with a suggestion that do you have sequencing in your hand. If not, it is better you do. The sequencing of each and every individual going to help the doctor to diagnose the disease much better way, to prescribe the medicine in a much precise way. That means that knowledge of genomics has to be much more rigorously created, and that is the role as an institute, as a researcher, as a student, all of us we have today. So few days back, I had opportunity to visit your university, and I realized, the dynamicity of the students or enthusiasm that the student that you have. It is the right time we work together between a research institute which is dedicated on genomics and the university like yours. As my previous people has explained, the science is nowadays is boundaryless. Genomics is a part of that bigger picture. Any problem you address today in biology, even if it is a basic science, you do not have chance to ignore genomics anymore. You need to understand. So that means that we have to integrate our course from the bachelor to master's to PhD and integrate the genomics within that course. And that is the why basically as an Institute of Genomics and Integrative Biology and the University of Kashmir, we plan to work together, to collaborate together and to understand the subject much better way. So this today's symposium is basically kind of seeding activities towards much bigger activities we plan for in near future.
This may seem to many as a new vision, as a new theme that we are opting for, or that we have to learn to understand. When we were students, when we were scholars, the concept of understanding genomics was at that time considered very difficult. And we were taught, major part of that teaching was theoretical. We could not practically understand how to understand the genetic setup, how to look at the genes, how to actually understand what the concept of understanding and the genomics is. But now we have entered an era where even youngsters at UG level know exactly what genomics concept is. And this advancement has in turn enlightened us that we should not only look at what can be the overall advancement in the subject as a whole, but how we can train, educate the youngsters for selecting the themes of genomics to see what are the fundamental properties of understanding the concept of sequence. When we look at diseases, as was pointed out by Dr. Altaf in the beginning, COVID was an international concern. The casualties, the impact, the effects, not only in a particular country, in a particular continent, it was a worldwide phenomenon where everybody was trying to see what can be the protective remedial measures that we can opt for. But once we look at how much we had to invest, how much we lost, and what the impact of that investment at present is, we know that understanding genomics, understanding concept of genomics and developing resistances is perhaps the way of overcoming such sort of problems that we are facing. Initially, everybody knew what the concept of gene is, what gene is, but to understand what would be overall value of fully assessing the genetic setup and assessing what the drawbacks of a gene are, what the overall genetic drawbacks in an individual are either inherited or induced by certain natural calamities, and how we can be able to overcome those, is perhaps the theme that we should spread amongst the younger generation. Everybody at present is looking for what are the best ways to have in his work or in his investment the market value. We look at, once we get registered for any master's degree or any research PhD program and so on, we look at the theme and try to see what could be my outcome and what could be its market value. And initially all of us concentrate on our specializations, but we have entered an era where every scholar, every teacher, every researcher looks at multidisciplinary concept of drafting a theme and understanding how that theme and the results can in turn have some sort of impact of not only my work or the work of the person, but what could be the market value of that work. Interdisciplinary research was, as Altaf rightly pointed out, the understanding of the genomics is not necessarily only related to biological sciences. Sometimes we actually interact with social science people to see what can be the way to understand the concept of genomic drawbacks. And that means a life sciences scholar can in turn be associated with social sciences also. And that obviously throws a new theme where we can understand the social aspects of the problem that we are facing, and that problem in turn can be resolved. Nisar Saab highlighted what we have tried to do. In the University of Kashmir, creating CIRI was a huge achievement. What sort of infrastructure we have developed and we are going to develop further, and what sort of equipment we have purchased within the last few years, is something that has given us a new concept of understanding genomics and using those facilities to educate youngsters that we are not in an institution, in a university, in a UT, where we don't have facilities. There was a time when I was a scholar, I had to visit Lucknow to carry out SEM studies. At that time, we never had such facility in the University of Kashmir. Now we have SEM facility also in the University of Kashmir as such. And to understand genomics, say about 20 years ago, we would have to visit such institutions, research centers where facilities were available. But now, with privilege, we will make a claim that we have facilities. And this in turn enlightens not only our visions, but also enlightens the themes that our youngsters should opt for. Because at one time, when people applied for postgraduate course or research degrees, they were looking for science departments and what are the themes in those science departments which have some sort of a value. But now, interdisciplinary research themes are backbone of achieving those goals. Since I handle the research registrations also, now in majority of the departments, a student is actually drafting a policy where part of work is done in his parental department, part of work in other department of the same university, and part of work outside the University of Kashmir in other states also. We have to depute students to Delhi. Say, my scholars are working partly in the JNU also, because some facilities we use from JNU. Sometimes I have to send my students to CDRI also, because I work on medicine, so I have to depute them to CDRI because some facilities are available there. Now, this in turn enlightens us that if we create such centers, and in these centers try to educate first our teachers, what are the facilities available, how we can use those, and then they will in turn educate their scholars how we can use of those facilities. Now imagine what the net outcome would be. In the University of Kashmir, the themes that would be drafted will enlighten the youngsters that they have not to always look for options outside the UT. we can invite, as was rightly pointed out by Nisar Saab. Last time we provided the facility of CIRI to many students from outside the university and sometimes from outside the UT also. And that is an achievement. Once our students have to visit other institutions outside UT, now we are inviting students from outside, they can work here.
It's my honor and privilege to welcome you all on behalf of University of Kashmir and IGIB New Delhi for gracing the inaugural function of the two-day Symposium on Genomics Towards Better Health. We are honored to have the gracious presence of our Honorable Vice Chancellor, Professor Nilofer Khan, whose leadership, commitment, vision, and unwavering support has been instrumental not only to this event, but every initiative of CII. Thank you, ma'am, for gracing the inaugural function. I extend a warm welcome to Director IGIB, Dr. Sauvik Mathi, who initiated the process of having Genomics Symposium at Kashmir University. Thank you, sir, for choosing Kashmir University as a collaborating institute, and we look forward for an exciting two-day symposium on genomics towards better health. It gives us immense pleasure to welcome Dean Research University of Kashmir, Professor Irshad Namchu, and Registrar Dr. Nisar Ahmed Mir for being with us this morning. I also welcome deans of various faculties, heads, directors, faculty members, distinguished guests, and students who have joined us from various colleges to be with us this morning. You know, the symposium theme, Genomics Towards Better Health, is of immense importance to public health. Genomics is playing a very important role in our day-to-day life, and it connects with every aspect of our lives. Genomics has and continues to transform our world in many different ways, be it agriculture, healthcare, energy, environment, and it has revolutionized the way we think about healthcare. And it is helping us to have better understanding of processes which cause illness or infectious diseases, and helping us to develop therapeutic interventions which were kind of unthinkable even a decade ago. Even genomics has played a very important role in shaping our response against the COVID-19 pandemic. We have seen how devastating the pandemic was, and genomics-based vaccines have played an important role in containing the pandemic. And today, the genomics-based technologies have changed our approach towards healthcare. And the faster, cheaper generation of genomic data is driving integration of genomics in all aspects of healthcare. It's an exciting field which offers endless possibilities, from discovery to diagnosis to startups, and with immense potential and power to transform human lives. But I personally believe that genomics has not picked up to the scale in this region as it has picked up in other parts of the nation. There are many reasons, lack of awareness, lack of training, lack of facilities. Center for Interdisciplinary Research, University of Kashmir, is playing a very important role in filling up the gaps. We are establishing a world-class scientific instrumentation facility, which we believe would go a long way in promoting quality science in the region. And with the support of various funding agencies and with the support of our Honorable Vice Chancellor, we are trying to set up a genomics facility in the university, which will not only cater the needs of researchers and clinicians, but it will also act as a training hub for our new generation. Because if we want genomics to, it has, as I said, it has immense power and potential to transform human lives. And training in genomics is fundamental to harness the benefits of this amazing field. So this symposium, Genomics Towards Better Health, is a step towards that direction, and we are confident that this symposium will provide ample opportunities and for fruitful discussions and foster collaborative research among different institutions.